Jacob, so you have somebody on durvalumab, and he progresses 9 months into it. What do you do? What's your treatment for metastatic disease?
Yeah. So, I mean, at that point, if this is someone who's non-squamous progression, I think carbo-PEM is still a reasonable next line option. Keep in mind that what they've gotten concurrent with radiation is none of those are really our classic metastatic regimens. So that being said, if someone has squam and they had gotten carbotaxol, that's weekly. 9 months out is a little further, but earlier than that, I'm not as excited about carbotaxol, even though they only got weekly. So, but you could do another one of the squam regimens. So I think you're looking at metastatic treatment and not really with a checkpoint inhibitor, because they've had treatment or progression on a checkpoint inhibitor.
Any other comments? What about if you progress 6 months after completing durvalumab? What's your regimen?
Well, then I think, 6 months, you can consider using a checkpoint inhibitor again, and then I guess I'd go into the metastatic pathways on that.
I think the key thing to emphasize here is that this is a completely data-free zone, right? We have no idea what to do in this space, and research is absolutely essential because Pacific really changed the landscape of how we treat locally advanced disease. I think that one thing which has also changed the landscape, there are other trials in locally advanced. The Nadim study came out recently looking at neoadjuvant chemoimmunotherapy in stage 3. I mean, there's lots of things that are changing the landscape in multiple different angles, and it's getting really difficult for these big trials to really know how to interpret them. But I think it's an exciting time to be doing this research, and a lot of advances are being made for our patients, which is great.